While this virus, we know, is indiscriminate in its transmission, we know that there will be a disproportionate impact among the 140 million poor and low-wealth individuals in our country. The interlocking injustices of poverty, racism, ecological devastation, militarism, and the false moral narrative of religious nationalism that the Poor People's Campaign have been fighting against in the last 2 years put the lives of these individuals at increased risk for contracting the disease and increased likelihood for death. The inequitable impact, both in the short term and long term, for poor communities and communities of color is made worse by an administration that has been delayed, uncoordinated, and reckless in its response and has favored profits over the people. This is a moral failure. We have failed frontline healthcare workers, from doctors to CPNs, by not providing them with the personal protective equipment they so desperately have called for in this moment. We have failed low-wage workers who have been deemed essential during this pandemic, but don't have the luxury to practice social distancing, and we haven't provided them with the resources necessary to protect them from getting the virus or adequate income protections necessary to sustain life in the face of lower wages and unemployment. And we need to do better.